Now let's take a look at the biological origins of gender identity first, and then sexual orientation in a moment. Brain development may account for gender identity. So in the hypothalamus, there is an area called the third interstitial nucleus of the anterior hypothalamus. It's referred to as INA3 for short. It is smaller among transgender individuals. In addition, responses to sex-specific pheromones, abbreviated here as and est, match those of the gender identity, not the biological sex. And the central bed nucleus of the stria terminalis, which is a structure often associated with emotion and is connected to the amygdala, this structure is smaller in transgender individuals. So we're seeing that there are brain differences in individuals that vary with their gender identity. Now, when we turn to sexual orientation, we're also going to see some biological factors. There's a little bit more research in terms of sexual orientation. In terms of heredity, we can see a higher identical twin concordance rate than a fraternal twin concordance rate. And so that, again, is evidence of heritability, right? Genetic research is finding some potential genes in addition that may influence sexual orientation on the X chromosome and on chromosome number 7. So there are starting to come in some studies looking at genetic markers or genetic basis for sexual orientation. In addition, there is some research showing possible prenatal influences. Research links prenatal stress and parental hormonal sensitivity. There's also this effect called the older brother effect. The older brother effect is that the more older brothers a male has, the greater likelihood of him being homosexual. And it's not also the case if he has more older sisters. It's only if there are more older brothers. Why is not known, but the suspect is that when women have a male baby, it produces different reactions in the body, and that some of this effect might be cumulative, so that the more male babies she has, the greater the influence on a later boy. In addition, we know that prenatal hormones may shape the brain, and so although there are no differences in adult hormone levels, there might be differences that can be traced back to prenatal hormone levels. Now, homosexual and transsexual individuals, we already learned this about transsexual individuals, but we're going to add homosexual individuals to this. They respond to the pheromones and est, like their opposite sex counterparts do. And so we can take a look here at a brain image showing in this area of the red and yellow the level and the amount of brain activity in response to the hormone and here we're seeing this in heterosexual women, homosexual males, but not in heterosexual males. So it's not a biological sex thing. It seems to have more to do with an individual being attracted to males who are going to be the ones who are releasing and. In addition, we can see that there are some differences between heterosexual males and, say, homosexual males on some of these cognitive tests. So one is the line, angle, and position test. And so this is a test of spatial relations. And the performance of gay men, shown here, is lower than that of heterosexual men in this study. The performance of homosexual women, shown here, was slightly but significantly higher than that of heterosexual women, shown here. In addition, we're seeing here in graph B that verbal fluency was higher in homosexual males, shown here, than in all others actually, including heterosexual females, and performance was lower for both heterosexual males and homosexual females who did not differ significantly from each other. So again, really seeing that sexual orientation is associated with some of these cognitive differences, just like biological sexes.